Table of contents. Origins of pharmacology. Drug regulation. Being a pharmacy tech. Lab safety. Prescriptions. Pharmacy regulation. Biopharmaceutics. Drug names and classes. The origins of pharmacology. Magic or medicine? I swear by Apollo the physician, and Asclepius, and Hygeia, and Panacea, to hold those who taught me this art equally dear to me as my parents, to benefit my parents according to my greatest ability and judgment, and I will do no harm. Wow. This is the Hippocratic Oath. Kinda. Essentially, the Hippocratic Oath requires a new physician to swear upon a bunch of different ethics, like doing no harm and prioritizing a patient's well-being. While it isn't a legally binding contract or anything, it sets ethical standards and is pretty much a promise to yourself and society. Medicine has existed for thousands of years with its roots in religion. Around the 20th century BC, Imhotep was the first physician known by name. He was deemed the god of medicine around 2,000 years after his death. These are some pictures of him. He seems like a pretty cool guy. On the other hand, Hippocrates, born 460 BCE, was the father of medicine. While there are many texts written under his name, like the Hippocratic Oath, it is suspected that he did not actually write them. Regardless, we know that his reputation and actions as a great physician established the foundations of modern medicine by separating religion or superstition from medicine. While his insight and knowledge gradually became less relevant over time, his ethical principles have remained one of the most important parts of medicine today. There are also like a gazillion more important physicians outside of this era, but the ones I mentioned are some of the most significant. Although medicine was originally explained by religion, scientific observation has shifted this view of medicine through thousands of years. Today, we are able to synthesize medicine, whereas thousands of years ago, humans only had natural remedies. We understand the interactions between drugs and the human body on a cellular level. We are able to understand the once unexplainable field of medicine. 2. Drug regulation. You might be familiar with cocaine or maybe LSD. Cocaine can be classified as medicine under some specific circumstances, while LSD is not considered medicine at all. The reason why cocaine and LSD are both drugs, but only cocaine is medicine, is pretty simple. Cocaine has a federally accepted medical use and it is classified as a Schedule II drug. LSD, on the other hand, which is less harmful, is considered a Schedule I drug because it does not have any accepted medical use, alongside a high risk of addiction. This brings us to drug scheduling. This classification of drugs is called drug scheduling and it is divided into 5 schedules. Schedule 1, high potential for abuse and addiction, no accepted medical uses. Schedule 2, high potential for abuse and addiction, has accepted medical uses, still considered dangerous. Schedule 3, moderate to low potential for abuse and addiction. Schedule 4, low risk of abuse, low risk of addiction. Schedule 5, low risk of abuse, low risk of addiction. Classification, passed in 1970 as the Controlled Substances Act, was just one law among many that aimed to regulate the distribution and usage of drugs. The DEA, also known as the Drug Enforcement Agency, is also a very important figure in the world of the pharmaceutical industry. We will go further in depth in Section 6. On top of the FDA, DEA, and state boards of pharmacy, there are also other organizations like the American Society of Health System Pharmacists, United States Pharmacopoeia, Joint Commission on Accreditation of Healthcare Organizations, American Society for Consultant Pharmacists, which set and maintain pharmacy standards. 3. Being a pharmacy tech. Requirements. High school diploma slash GED. You also need formal training at like a community college, technical school, or on-the-job experience. You have to pass a PTCE or XCPT. You also have to renew certification every 2 years with 20 hours of continued education credits. I put down what the abbreviations stand for if you're curious. Other requirements include math skills for dosage calculations, attention to detail, knowledge of medical terminology, computer skills, and an understanding of pharmacy laws. Some places you can work at is like CVS, Walgreens, independent pharmacies, long-term care facilities, and pharmaceutical companies. 4. Lab safety. Number one most important thing is sterility. Since sterility is an absolute term, either a formulation is sterile or it isn't. Drug manufacturers are held to a very high standard in this regard. Because of how fast a formulation can circulate through our bodies, injectable formulations or ophthalmic, intranasal, and inhalation formulations are required to be sterile. However, dermal and vaginal formulations are not required to be sterile because they have their own defense mechanisms and microbiome. Both manufacturers and pharmacists and pharmacy technicians are held to a very high standard. With the high standard of having to keep formulations sterile, that also means working in special environments. For example, the laminar flow hood on the left, which provides sterile airflow, the biological safety cabinets for hazardous drugs in the middle, and clean rooms, which are controlled environments with specific air quality requirements on the right. There are also a bunch of strict aseptic techniques, which include proper hand washing and gowning procedures, using sterile gloves, disinfecting work surfaces, proper handling of vials and ampoules, never touching critical sites, which are like any exposed area like the tip of a needle, and working efficiently to minimize contamination risk. 5. Prescriptions. Prescriptions, also known as RX, are the foundation of what pharmacy technicians do every day. Here are the required elements of a prescription. First, the name and address, the prescriber information, the DEA number, the NPI number, the date and inscription, the SIG, which are like the directions, the signature of the prescriber, and refill instructions. As a pharmacy technician, you'll need to learn a bunch of pharmaceutical abbreviations. Here are some of them. One of them that I really like is OD, which is right eye. O stands for Oculus, D stands for Dexter. Conversely, for left eye, it's OS, which is Oculus Sinister. Yep, pretty cool. Yeah, there's a bunch of abbreviations which you're really gonna use like a lot if you're gonna go into pharmacy. These measurement ones you probably should know, but here they are. And some other like stuff, I guess. Here are some examples of how they're actually used. And yeah, they kind of look like gibberish. Filling prescriptions. 1. Receive and review the prescription. 2. Enter patient and prescription info into the computer system, like name, date of birth, allergies, insurance, medication name, dose, and directions. 3. Perform a drug utilization review, which is checking for drug interactions, allergy conflicts, duplicate therapies, which is making sure multiple drugs that do the same thing aren't prescribed, and select the correct medication, count or measure the medication, label the container, have the pharmacist perform the final verification, and then the pharmacist explains important info like how to take it, side effects, and answers questions before giving it to the patient. 6. Important pharmacy laws. In addition to following drug laws, pharmacies are required to maintain strict documentation, especially for controlled substances. This is where DEA forms come in. They are used for registration, ordering drugs, and inventory management. Here are a bunch of like the most common ones. Other important laws slash regulations include HIPAA, which you may be familiar with, as well as handling insurance. HIPAA, the 1996 Health Insurance Portability and Accountability Act, is crucial for protecting patient privacy. PHI is a pretty relevant term and it stands for Protected Health Information. PHI is just any individually identifiable health info like health data, names, SSNs, addresses, or emails. Essentially keep all patient information confidential, only access patient records when necessary for work, do not discuss patients where others can hear, ensure computer screens aren't visible to others, properly dispose of documents with patient information, and never take photos of prescriptions or patient information. Lastly, health insurance. For insurance and billing, working in the pharmacy primarily entails verifying patient insurance info, submitting claims electronically, understanding rejection codes, processing prior authorizations, working with copays and deductibles. 7. Biopharmaceutics. I like to call this section the fun and interesting part because it is. The journey of a drug through the body follows 4 main steps, which is usually referred to as the ADME process. We're going to focus on absorption. Routes of administration. 1. Oral. The term associated with this is peroral or peros, or PO. Absorption occurs primarily from the stomach and intestine. Solid drugs taken orally can be taken in many forms, like tablets, capsules, or powders. However, the reason why some drugs cannot be taken orally is because even with an enteric coating, drugs may be reduced or degraded from gut enzymes or liver enzymes. This is also known as the first pass effect. This can explain why oral doses may be significantly higher than other ways of administration, as only a certain percent of a drug reaches the circulatory system. This is also known as bioavailability. Liquid drugs come in the form of solutions, suspensions, gels, and emulsions. Liquid dosage forms reach the circulatory system faster because they skip the process of being disintegrated. 2. Sublingual and buccal. Sublingual refers to under the tongue, which is pretty easy to figure out when you consider that sub is under and lingual is tongue. How logical! Buccal is referring to between the cheeks and teeth. I personally just remember that buccal is the cheeks, but you could maybe think about how CC could be remembered as like the two cheeks. The main reason these are different from taking drugs orally is that these avoid the first pass effect because of how thin membranes in the mouth are and the rich blood supply, both bypassing the digestive processes and also being absorbed into the circulatory system much faster. However, there are some limitations. If a patient has mouth issues, another mode of drug administration may be preferred, or if a certain drug just doesn't taste good. 3. Rectal. The rectum. Rectal administration is used to avoid the first pass effect and if a patient cannot take a medication orally, like if they're vomiting or unconscious. No meaningful pictures for this one. These are the parenteral routes, which mean pretty much anywhere other than the mouth. We got intravenous, intramuscular, intradermal, subcutaneous, ophthalmic, intranasal, and inhalation. I have like a pretty cool visual coming up. I guess like intramuscular, subcutaneous, intravenous, intradermal kind of just describe how deep under the skin it is. But yeah, this is a pretty cool visual. Okay, moving on to distribution. Distribution. This is just how the drug moves through the body. Drugs move through the bloodstream to target tissues. Some drugs bind to proteins in blood. Distributions can be affected by blood flow and tissue permeability. These are drug interactions. Drug-drug is where one drug affects another. Drug-food is where food affects how a drug functions. And drug supplement is how supplements can interact with like drugs. One drug-drug interaction you might be familiar with is Narcan. It can be used to help reverse the effects of an opioid overdose because it basically kicks the opioids out of the receptors. W Narcan. Metabolism, breaking it down. Primarily occurs in the liver. Convert drugs into metabolites, which is just what it's called when it's broken down. Some drugs are prodrugs that must be metabolized to become active. The first pass effect happens here for oral medications. Excretion, how the body eliminates a drug, primarily through the kidneys and urine, also through bile, feces, sweat, and exhaled air. Patients with kidney or liver disease may have altered excretion. Here are some other important factors: age, weight, gender, genetics, pregnancy and breastfeeding, time of administration. I want to mention weight because dosing is often based on body weight, pregnancy because some drugs are just like bad for the baby, and time of administration because your body follows a circadian rhythm. 10. Drug names and classes. Every drug has multiple names, which is very confusing. Yes, I hate this section. The chemical name describes a chemical structure. It's not really used in pharmacy, but it might be used by like chemists and researchers. There's a generic name, which is the official pharmaceutical name. For example, acetaminophen. There's also the brand name, which is the manufacturer's marketed name. For example, Tylenol, which is really common and you should probably know it. The reason for both the generic and brand name low-key comes back down to greed. The brand name is protected by a patent, but once the patent expires, other manufacturers can make the generic version. Major drug classifications. Drugs are organized into classes based on what they treat. Before I just list words, we should learn some important root words. Anti, which is against, an, without, and ic, which is like relating to. So analgesic, it would be relating to being without pain. Now that we have the basics, let's dive in. Analgesics, pain relievers, antibiotics, fight bacterial infections, antihypertensives, lower blood pressure, antidiabetics, control blood sugar, anticoagulants, prevent blood clots, bronchodilators, open airways, diuretics, remove excess fluid. Keep in mind, You're probably never going to remember every drug name. Even most people who work with drugs don't. Nurses don't need to. They don't need to remember every single drug's generic and brand name and their functions, but it's extremely important to have a general idea of root words so you can get a gist of a drug's function just at a glance of its name. So the main lesson I'd say to take away is that learning root words is really, really important. For example, statin refers to cholesterol-lowering drugs, while psyllin refers to penicillin antibiotics, like an amoxicillin or nafcillin. There are a lot of other examples like this, and I personally just searched up pharmacology, drug suffixes, Quizlet to help study them. Anyways, there's a lot more about pharmacology, but this is the very surface level overview of it. Goodbye. Actually, one last comment. I wanted to learn After Effects for fun, which is the software I'm using to make this. I also needed to study pharmacology for my HOSA event. That's about it. See you later, alligator.